Hello and welcome to another anterior guidance how-to clinical video. Today we'll be taking impressions.
The materials that you'll need to take an alginate impression are alginate, water, a spatula, a tray, adhesive, and a bowl to mix it in. The first thing that you need to do is try in the tray to make sure that you have the correct size. Once you are sure that the tray will fit, the next step is to spray a light layer of adhesive. Once the adhesive has dried, you are now ready to mix the alginate. Pour the water into the bowl and add the powder to the water, not the other way around. As you are mixing the alginate, make sure that you gather in all of the available powder. Your mixing motion should include smashing the alginate against the side of the bowl to ensure that it is mixed well and to reduce powder chunks and bubbles. Gather the alginate on your spatula and place it into the tray. Make sure that you are filling it completely so that there are no voids or bubbles. Smooth the surface of the alginate and then take a wet finger and make a slight depression where the teeth will go. This will allow the alginate to better form-fit the teeth and gingiva in this area. Next, in order to avoid bubbles on the occlusal surface of your impression, take some alginate and wipe it on the occlusals of the teeth in the arch that you are taking the impression of. You are now ready to take your impression. Come from behind and above your patient and place the tray with alginate at an angle inside your patient's mouth. As you apply upward pressure, be sure to do so from the back to the front, ensuring that the excess alginate will spill out the front of their mouth and not down their throat. Lift their upper lip up and over the alginate and the tray to ensure that the vestibule is captured in your impression. After waiting the appropriate amount of time, you can check if your impression is set up by feeling the excess impression material coming out the front of the tray. To remove the impression from the patient's mouth, apply firm downward pressure as you gently wiggle the impression tray until the negative pressure is released and the impression pops out of the patient's mouth. In order to disinfect your impression, first rinse it and shake off the excess water. You can now apply a disinfectant to all surfaces of the impression. After you have waited the minute that it takes for the disinfectant to work, you can re-rinse your impression and place it in a plastic bag. Make sure that you do not wrap your impression in a wet paper towel. When stored like this in a plastic bag, your impression can last up to 30 minutes without distorting.
And that's how you take an alginate impression. Now all you have to do is pour it up within 30 minutes of taking it and you're great.
Thank you for watching our video on how to take impressions. Join us next time when we show you how to pour up your impression into a study cast.